is the inflammatory diseases of the breast. This includes acute mastitis, periductal mastitis, and fat necrosis. In acute mastitis, the patient has a infection, usually Staphylococcus aureus or Streptococcus. This is a localized infection. This is a diffused infection. This is seen on women that are not breastfeeding due to as inflammation of the breast, and in breastfeeding women, engorgement breast. The most common causes are this bacteria, but also could be some fungi or other bacteria. The treatment is to treat against Staphylococcus aureus that could be with dicloxacillin or cefalexin. Sometimes this can lead to an abscess. So an abscess would be a collection of pus. The patient will have purulent discharge, and here the patient will need to cover not only Staphylococcus aureus, but if we suspect that the patient has MRSA, then we need to give trimethoprim sulfamethoxazole or clindamycin. And the clinical presentation will be erythematous, palpable mass, tenderness, etc. In periductal mastitis, this is secondary to a block of the duct that leads to inflammation due to infection. This block occurs because in smoker females there could be a squamous metaplasia because of vitamin A deficiency also, and so this blocks the duct. This presents as a subareolar mass, and again with tenderness, fever, malaise, etc. Lastly, the fat necrosis. This would be presented as a patient with trauma to the breast, or maybe they even don't recall this, surgery to the breast, injection of substance into the breast, and this would be diagnosed usually as a incidental finding on a mammogram as calcifications due to saponification, but because calcifications are also seen on carcinoma of the breast, we can get confused, and often we biopsy the lesion. So in biopsy we will see foam macrophages. We will see a central necrotic lesion that is surrounded by polymorphonuclear cells, and then will be surrounded by a fibrous tissue, and then surrounded by a scar. Now, lastly, I forgot to say the mammary duct ectasia. This is inflammation with dilation of the duct, subareolar duct, and arises classically in a postmenopausal multiparous woman. This presents as a periareolar mass with green-brown nipple discharge. That are the inflammatory debris. And this is due to chronic inflammation with plasma cells. Chronic inflammation with plasma cells would be seen on the biopsy. So these are the inflammatory conditions: acute mastitis, periductal mastitis, mammary duct ectasia, and fat necrosis.